In this video, we're going to talk about sepsis and septic shock, how to recognise it and treat it within adult inpatients in ESNEFT. Sepsis is a life-threatening condition that can be prevented if identified and treated early. Simply, sepsis is the body's dysregulated response to an infection leading to the body damaging its own organs and tissues. According to the UK Sepsis Trust, 245,000 people are affected by sepsis annually, with at least 48,000 people losing their lives in a sepsis-related illness. Inflammation is one of the body's defence mechanisms against microbial invaders. These may be bacterial, viral or fungal. Microorganisms trigger inflammation when they enter into the body. Cytokines then notify the body of the foreign substance, triggering a histamine to be released and the capillaries to vasodilate, as shown in the diagram. Cells in blood vessel walls are usually packed together tightly. However, during this inflammatory response, gaps open, allowing inflammatory agents, such as white blood cells, to leak out into the affected area. A clotting cascade is also initiated to prevent pathogens entering into the bloodstream. In sepsis, this inflammatory response becomes dysregulated. The body's vascular system becomes vasodilated throughout the whole body, reducing systemic vascular resistance and therefore slowing blood flow to the vital organs. This reduced perfusion to vital organs is why patients with sepsis can deteriorate so quickly. It is important you know the initial signs of sepsis no matter your role within ESNEFT. Fever in the general adult population is no longer classified as an initial sign of sepsis. However, a fever above 37.5 degrees centigrade in women during labour or those with neutropenia should be considered. Hypothermia, if someone has a temperature below 35 degrees centigrade, is a sign of deterioration and will need acting on quickly. When the brain doesn't receive adequate oxygen, an altered mental state may occur. This may present as unusual confusion or drowsiness. In order to try to correct the reduction in oxygen perfusion, the lungs and heart work harder, increasing both the respiratory and heart rate. However, when unwell, the body cannot compensate for lung and blood pressure and oxygen saturations can begin to fall. The reducing blood pressure can result in a drop in urine output and potentially an acute kidney injury. Finally, feel your patient's hands and feet. They may be more cool than usual. Skin can become mottled and discoloured, and in darker skin tones, skin may look ashen or grey. Sepsis can develop into septic shock if not recognised and treated promptly. Septic shock is sepsis with persisting hypotension despite fluid correction and inotropes, and hyperlactatemia with a serum lactate level of greater than 2 millimoles per litre. When our bodies enter a state of distributive or septic shock, organs aren't being perfused due to a decreased systemic vascular resistance. This takes us back to the inflammatory response where vessels vasodilate or increase in diameter and become leaky. This reduction in oxygen delivery to the tissues leads to cell death and an increase in lactate leading to multi-organ failure. In sepsis, this can be rectified with IV fluid resuscitation, where the circulating volume is increased, filling the vasodilated vessels, improving the systemic vascular resistance. However, once a patient has entered into septic shock, the body needs further drugs to increase systemic vascular resistance and reduce the rate of cell death. This treatment has to be undertaken on the critical care unit. So what can we do to recognise sepsis early? The first step is to know the initial signs as discussed earlier. Secondly, we can combine our instinct and the patient's National Early Warning Score or NEWS score to determine signs of deterioration. Any patient scoring 3 in one parameter or a total of 5 must have a sepsis screen completed unless indicated otherwise on a treatment escalation plan. This document should be available on all Dynamaps within ESNEFT. If you are working in an area using Sentinel, the score will be automatically generated for you. There are several sepsis screening charts in use in ESNEFT depending on where you work. In this video, we will concentrate on the inpatient adult screening chart, which is used in the majority of areas. Let's work our way down the form. So firstly, does the patient score on their news, or do they look unwell, or are you clinically concerned? Then could this be due to an infection? In this case, we're going to say yes. We will discuss later what to do if the patient is deteriorating for a known reason that isn't an infection. Does the patient have any red flags? If so, we need to ensure we notify an ST3 registrar or above to review. If there is a delay in a medical review, you can still commence certain parts of the Sepsis 6 prior to the doctor's arrival. It is essential this patient is reviewed within 1 hour. If the doctor is not able to make it within 1 hour, ensure you document what time you contacted them and the reason for them being unable to attend. If the patient has no red flags, we need to see if they have 2 or more amber flags. If they don't, we can simply continue to reassess the patient at regular intervals to ensure there are no further signs of deterioration. If there are 2 or more amber flags, we need to ensure there is a clinical review and complete all elements of the sepsis bundle other than antibiotics within 1 hour. Initial emphasis should be on checking the lactate and other blood results. If the patient's lactate is above 2 millimoles a litre, they automatically have a red flag and will move on to the red flag sepsis pathway. On the back of the sepsis screening tool, the Sepsis 6 pathway is clear to follow. A further YouTube video is available to talk you through these steps. If you have any further questions, please contact the deteriorating patient nurse specialists in either Ipswich or Colchester.